Ladies and gentlemen, welcome to the Medtech Impact Podcast, where you get to hear from leaders and innovators who are shaping the future of medical technology. I'm Kyle Cruz.
And I'm Richard Meiklejohn.
And we're your hosts of the show.
So, 2025, kicking us off on the Medtech Impact Podcast, our first recording of the year, we have David Dlesk, CEO and co-founder from Embrace Prevention Care. Dave, welcome to the show.
Thanks so much for the opportunity to be here and kick off the new year with you guys. It's going to be an exciting one.
Well, Dave, we know you from your time back in the M2D2 Impact program in late 2023, and you are addressing a significant problem like many of the innovators we speak to. But I think in terms of the market you're looking at, preventative care just being such a huge essential need to try and improve healthcare. Super excited to have you on the show and learn more about how Embrace is doing that. But before we get into all that, tell us, what is the big problem ultimately that Embrace Prevention Care is looking to solve?
The thing that we're trying to go after is the fact that we know which people are sick. We know what they should do. We tell them what to do, but they don't usually do it. And as a result, we have epidemics of cardiovascular disease, obesity, diabetes. All these things are preventable. And it isn't because we don't know what people should do. The problem is that it takes behavior change, and behavior change is hard. And so that's the problem that we're trying to solve. And in particular, right now, we are focusing on working with older adults with dementia. But this kind of approach of providing virtual preventive care can be applied to anybody at any age.
As you highlight, so many people with chronic health conditions, looking into the background of all this, people potentially haven't been getting those preventative screenings that they should have or they could have. And so, clearly you're trying to create a better process, better awareness, better system for people accessing that type of care. What are some of the statistics around the people who are affected by not accessing that type of care?
Well, Richard, part of the problem, the big problem is that prevention isn't paid for in our healthcare system. We really have a sick care system. We pay for things. Once you get sick, then we take actions and you get paid for. So part of it is, the whole policy side of it, and we'll address that later where we have a great opportunity. But, we have to align the incentives in order to get the preventive care that people need. And a lot of times, it isn't a matter of people don't know that they have issues or they haven't been diagnosed. The problem is they aren't taking the actions, because 95% of preventive care is up to the patient. They have to take the actions. And this is where we take people right to the edge. We tell them, okay, this is your disease. This is what you should be doing. But then it requires behavior change. And a lot of times that's difficult for people and they don't do the things. And that ranges from taking their meds properly to following their doctor's advice as far as exercise, diet, doing other things that, are part of their care plans. But at the end of the day, what we're trying to do is to help implement physicians' care plans, help people take the healthy actions that are going to keep them out of the hospital.
Kyle, I feel like this is the perfect time again, kicking off 2025. Everyone's coming in fresh with their new year's resolutions. And so behavioral change is sometimes at the front of people's minds, but often it just drifts away. And, those kind of older habits, live longer, unfortunately.
I think today is actually called Quitters Day. So it's like the second Friday in every January that they call Quitters Day. So no, you're spot on, Richard. And, David, obviously this is this is a problem, right? But I'm really curious, kind of like, what does prevention look like today? Like, who is offering prevention services? What does that standard of care look like today?
Where we are today with prevention, and again, it's because it doesn't get paid for, it's rarely done well. So we do have, for older adults, there are annual wellness visits that are supposed to be sort of the jumping off point for prevention. However, even with these that are offered free from Medicare, there's no copay associated with them. Most people don't even get that. And again, it comes back to sometimes they aren't even aware that it exists. Their physicians don't push it because physicians typically don't get paid well for prevention. And so if our system is driven by economics, and if people aren't getting paid well enough for it, it doesn't happen.
What about like Visiting Angels? Hey, I'm sure you've probably heard of that organization. Do they have anything to do with prevention? Are they trying to help in those areas as well? I was doing a little bit of research beforehand, and I was just trying to better understand, how these patients are being taken care of and cared to, what have you. And it just seemed like, there's these services out there, like Visiting Angels. Is that kind of what you're talking about, or is it different?
Well, where we see the gap and what we're trying to fill is having a frequent interaction with patients to build a relationship, because this is the gold standard for behavior change, is working with another human being that you trust, that is going to hold you accountable, and we are accountable to them, to help them over the barriers to do the things that are going to keep them healthy and out of the hospital. And so, there are a lot of things that are focused on in terms of after people have been in the hospital, or when they're very sick, but where our system really just doesn't provide a consistent point of prevention is on the ongoing types of things that people just need to change in their lives to be able to reduce the advance of disease. And again, we're primarily talking about what we do is working with people that already have chronic conditions. We aren't going to cure them, but the idea is to slow the advance of disease such that they can live with those and not go to the hospital.
Got it. So is this more of like early diagnosis, early detection too, in a way?
Yeah, where we come in on that side is by having a relationship with the patient and having frequent interactions, and we encourage them to call us if anything changes. Now primary care physicians are so busy and it's hard to get to them that people often don't even call their PCPs. They'll go to the urgent care center instead, or to the ED, which is worse. And
Yeah.
so the whole idea is, as far as diagnosing things early, is to understand when something changes. And we use nurse practitioners who have a good overall understanding of the patient, and are able to sort of pick up the breadcrumbs and put together the trail in terms of what's going on, and then may suggest, hey, maybe it's your medication, maybe we need to change that, or maybe it's this in your diet, and let's look at that. But it's getting ahead of things that keeps people out of the hospital.
Yeah, that's great. And Richard, yeah, I know you want to chime in here too. And I will say, I'm super curious as well how Embrace now is kind of changing this standard of care.
I think the thing that we bring differently to the ballgame is the idea that virtual preventive care, using a well-trained clinician, a nurse practitioner, to have frequent interactions with the patient via preferably video conference, but also could just be the phone if that's all the patient, the technology that they're comfortable with. But by having these kinds of interactions, is that we fill this gap in between when the physician or when the patient is with the physician in their office and when they're home most of the time. And what we find by having these virtual interactions is that when people are at home, they're more comfortable to talk and open up. They don't have the same kind of concerns, and you don't have the dynamics of being rushed in the office, and they open up more, because what we're doing is creating a relationship. And in order to get people to change behavior, we have to focus on what matters most to them. It can't be the doctor is telling you to do this, so you have to do it. It's putting in the perspective of, here's your health and you're on a trajectory. And with older adults like myself, unfortunately, that trajectory is down, and what we're trying to do is to change the slope by getting people to understand what are the things that they can do and what are they willing to do in order to change their health to do what matters most to them.
Yeah, I just wanted to sort of prefix some more of this conversation as well, because I know you mentioned this big focus around dementia, and I guess some of the drivers economically for all this. When we look at the cost today versus the projected costs, we're going to go north of $1 trillion by 2050. We're going to expect the population size to triple as well through that timeline. Thinking specifically about those dementia patients, again, you mentioned prescriptions. We don't have any cure for dementia. And so clearly preventative care and assistive care is so important for those patients. So, how are you thinking about that coordinated care for those patients?
Great question. And this is where, we have a great opportunity to focus on patients with dementia. It's really at a turning point for dementia as a disease. And, in the same way that we see, changes around obesity with GLP-1s, we're just starting to see some medications coming out that don't cure Alzheimer's or dementia, but can slow the advance of disease. But they can only, the drugs right now only work when you're at the beginning stages of the disease, when you're mild. So it becomes really important to diagnose early because not only are the drugs effective at that time, but the other evidence that is showing is that the lifestyle changes that you can make can also have an impact on slowing the advance of disease. And so these are, the big three that impact virtually all disease. Exercise, diet, and sleep are three of the key things. And then with Alzheimer's, one of the other key things is cognitive engagement. And so this is where, we focus on working with patients to be able to not only manage their other chronic conditions, because dementia patients typically have at least half a dozen other chronic conditions, because the dementia is primarily diagnosed from 75 to 90. So we've accumulated a number of chronic conditions. So we have to manage the whole person, their dementia plus all the other things that are going on.
Yeah, Kyle, I heard that word exercise. It's again the start of the year and it's top of people's minds for a short space of time, but then it quickly drifts away. So, and they've also mentioned about that relationship part of healthcare. It seems sort of crazy that we don't necessarily always have with the primary care provider that sort of close relationship where you would build trust, and you maybe would follow their guidelines more closely or the advice that's given to you.
It's a good point, Richard. And, it's funny because I just think about even like myself, right? I mean, bit of an inward looking experience here, but I know that when I go to the doctors, oftentimes they'll tell me, hey, especially right now as I'm, getting older, there's some concerns coming up, right? In my physicals, it's like, hey, your cholesterol is kind of increasing, your blood pressure. And they tell you, hey, you really need to eat less of this, don't drink alcohol, get better sleep, right? And do I listen? Not as well as I should, right? And I think that's the challenging part is how, and I think it's the how right there. It's like, how do you get people to actually take action? And, Dave, like how are you going to do this with Embrace?
Yeah. Well, we've been doing this for the last few years, and we have some great results. We've been able to show with older adults with multiple chronic conditions, we've been able to reduce their hospital days by 30%. Now that's a big number, and that's without a drug or a device. This is just about helping them to take the actions that their PCPs and their specialists have already outlined that they should be taking. And this is really the key, is that just going to the doctor isn't enough, because it's been shown that patients after a doctor's visit, they recall perhaps 25% of what has been said. And then patients with dementia, it's even more difficult. Usually they'll go with a caregiver, and then it's what the caregiver hears and the patient hears. But the key thing is to be, what we do is that we amplify the physician's voice on a regular basis in terms of bringing those messages back. And it's part of it is education. Part of it is, again, turning it back into what matters most for you. How is this going to impact your life? You want to continue to live in your home. Okay, Well, that means you have to remain independent. That means you have to be able to get up and do things. If you have a very sedentary lifestyle, we got to get you up and moving. So, it all comes back, and this is why we call it personal prevention care, because there's no one way, to do it, is that we have to look at each person. What are their risks? What are their motivations? And this is sort of where the magic comes in, where our nurse practitioners have to be both great clinicians, but they also have to be great coaches. Because if you've had great coaches in your life, they are the people that they don't treat everybody the same. They know how to push your buttons. They know what you're capable of, and they help you to be the best that you can be. And that's what we try to do with all our patients in order to keep them, active in the community and doing the things that they want to do and out of the hospital.
I mean, I think it's just so amazing. And it's funny because, Kyle, we think a lot and talk a lot about marketing. And when Dave's talking about this messaging, we have all these other messages around us telling us to do all these things probably we shouldn't be doing. Just sit here and watch this TV, or sit here and play this game, or watch this app, and engage with things, again, that maybe aren't great for your lifestyle. And I think in terms of like that messaging you're talking about, it's so important. It's consistent, it's healthy, it's good, positive messaging to take positive actions for your life. I'm looking at one of these things back here that, Clayton Christensen had with the innovator's prescription. And, his quote from that is, disruptive innovations enable less expensive caregivers and less expensive venues of care to become capable of doing progressively more sophisticated things with equal or better quality than their high-cost counterparts. And clearly that's what Embrace is all about. So it's fantastic to see you leading on this mission, Dave.
Yeah, I'm glad you brought that up, because that's what we see is really missing in our healthcare system, is this virtual preventive care, where you have a preventive care clinician that works with everybody more frequently than you go to your doctor, because the doctor is trained to diagnose and treat disease. Their expertise is not helping you to take the actions. And this is what we're missing again, across all ages in society. It's not just with the older adults. We focus on the older adults and people with dementia because the cost is greater there. They go to the hospital more frequently. And so we're able to demonstrate the effectiveness, the cost effectiveness of prevention more quickly, which is important because, as we've talked earlier, what gets paid for gets done. And so when we can show that we're saving money, then we can get paid for that, and it'll happen.
Dave, it's perfect timing. Why don't we get into the elephant in the room, the numbers? What's some of the economics around this? What's the kind of the business case that you're presenting, saying, hey, we can actually do things a different way, in a better way?
Well, this is where the government, as Medicare, has actually come in and created a new program called GUIDE, specifically for dementia patients and their caregivers. And essentially, they have created the opportunity to provide what we're doing, virtual preventive care, to patients so that there's no cost to them, no co-pays. And there's a $2,500 reimbursement annually for respite care to be able to give the caregivers a break. So why is CMS doing this? Well, they see this coming wave of dementia patients as baby boomers age into the prime dementia years, 75 to 90. And ultimately, all the costs come back to Medicare Medicaid, because most people end up, dementia patients end up for some part of their life in a skilled nursing facility, often on Medicaid, because it's so expensive. And so as a result, they have started this program to try to reduce hospitalizations, reduce the amount of time people are going to be in nursing homes, and extend the time that they're healthier and can live in the community. And so they've created this program, and the patients can opt in. They don't even need a doctor's referral to opt into this program. So they've really made it easy for people to access this type of care. And there have been 300 organizations around the country that have been chosen to be able to provide this guide care. It's an 8-year pilot program. And the idea is that we're going to prove that this is the type of care that people that need, and hopefully then it becomes the standard of care.
Excuse me, I would imagine that there'd be obviously a lot of education. How do you plan to kind of get the word out here? I mean, is this a joint effort between CMS and Embrace? How do you let the people know, hey, there's this program, there's an opportunity. You don't need to opt in. You don't need to, to be referred by your doctor. You can just go and do this and take advantage.
Yeah, great question. And one thing I'll say is that I think this program is great. So it just started in July past year, but CMS has not been publicizing it yet. There are two cohorts of organizations, established groups like us who have started marketing this last July. There will be another 2/3 of the companies that start this July. And so they haven't really been publicizing it too much, I think, until all the organizations are in it. But our focus is to go to where the dementia patients are. And those are really, in three buckets. One, we're working with neurologists and neurology practices because they have a lot of dementia patients. We're also working with primary care physicians that serve patients in assisted living because people go into assisted living when they start to decline and they know they're going to need some help. So again, a lot of dementia patients there. And then the third group that we're working with are federally qualified health centers and community health centers because there's a higher prevalence of dementia in lower income people, and it's less likely to be diagnosed. And so we're working sort of on a health equity standpoint, and because in general, lower income people get less resources anyway. So we're focusing there to be able to bring these resources, to those populations as well.
Do you have to be diagnosed actually in order to take advantage of this program?
Great question. Yeah. So the requirements to be in the program is that you have to have a dementia diagnosis, and you have to be in traditional Medicare. So if you're in a Medicare Advantage plan, or you're in a PACE program, or in hospice, or if you're already in skilled nursing, you don't qualify. So it's people in the community on traditional Medicare that have a dementia diagnosis. Now, one of the things that we see is that because there haven't been good treatments for dementia in the past, it's very much underdiagnosed. Primary care physicians have been hesitant to diagnose dementia because there's a stigma attached to it and there was nothing that they could do. Now that's changing, where we know that there are lifestyle things that can slow the advance, there are drugs that can do it, but again, only if you're diagnosed early.
Right. And obviously, I think if you can avoid taking any drugs and medication and stuff like that, if there's things that you can do outside of it early and often, boy, wouldn't that be nice. This is fascinating to me too, Richard, because, I'm also thinking about something that Dave, you were talking about the neurologist, I think, and what's interesting to me. Oh yeah. So diagnosis, right? So is the plan and strategy when someone's diagnosed that I'm assuming, hey, this diagnosis is given, and that's not an easy piece of news to deliver to your patient, and that's really tough, right? And at that point, you're talking about treatment options. Is that where Embrace comes in? So when that doctor or clinician, whoever it is, when they're diagnosing their patient, is it like, here are your options, hey, and here's a program that's supported through CMS. It's called Embrace. It's something that we would, highly recommend you, consider and take advantage of. Is that kind of a way you're going to then introduce this to patients?
And that's sort of a secondary, just as far as a go-to-market strategy is, it's first, we have to get patients into the program as quickly as possible. And so this is where working with the neurologists who are, typically their patients are already diagnosed. Okay. But what we can provide there, again, is the support for the patients to be able to, carry out the things that their neurologists, want them to do, and to be able to address, all the in-between things, and specifically work with the caregivers, because this is one of the things that's really important in dementia. Is it's known as a family disease because one, it's terrible as you watch your loved one sort of slip away. but people, typically want to be able to take care of their, their mother or father or their aunt or uncle, as long as possible. But it requires, puts a heavy burden on the caregivers. So the whole idea is that we bring them in and we educate them. That's one of the requirements, and that we include them as part of the care team, and we let them know this is what should be happening with your loved one, and here's what you can do. And so we take that burden off of them in terms of searching the internet, saying, okay, well, how should I take care of mom? What should I be doing? They actually become part of the care team. And in that way, they can focus on the things that are going to have the biggest impact and have the confidence that they're doing the right things. That alone reduces a lot of the stress and the burden. Plus, having this $2,500 of respite care paid for when they can't be with their loved one and they have to have someone come into the home or to take them to adult daycare for 4 hours to be able to do something that they need to do.
I'm so glad you highlighted that, because that was my next question about the caregivers, because as you point out there, it's just such a significant part of this disease, how that affects people. And again, you're highlighting the people who potentially come from lower income areas who are worse affected by having to care for family members or people who they're responsible for. So, in the next 6 to 18 months, I know this is a new program you mentioned. So as you're standing this up, what lies ahead? How do people engage?
Yeah. So, like everything else in healthcare, things always move more slowly than you want them to, right? So, what we see, over the next 12 to 18 months is, we're looking to establish, this year, we're looking to establish partnerships with about 15 organizations and across sort of those spectrums that I talked about in terms of neurologists, primary care practices, as well as FQHCs and community health centers. And so, what we look at this year is that we intend to, end the year with about 1,000 patients. And as a company, what we need to do next is we need to raise a seed round of about $3 million. And what the VCs, they want to see, they like the idea that we're in this market that's protected. Essentially it's an oligopoly where CMS says they're not going to bring in new participants that are, providing this, and there's a huge need for it. But they want to see, patients, that you're serving and in the pipeline, et cetera. So that's our focus, to find, again, the early adopters that really recognize the value of this program, are willing to, step in and say, okay, I want to be a part of making this, the standard of care. And we have, we already have 4 other partners that are doing this, and we're in the process of hiring a great neurologist who's going to help introduce us to other neurology practices, because as many of your listeners in the Medtech community know, it's not easy to get in front of doctors these days. And so, so that's one of our approaches, to be able to get to them and really, open the door more quickly and have somebody speaking on our behalf that can say, yeah, this is a great program.
Yeah, so much upside potential here, Kyle, from the impact for patients, for their carers, for investors, of this opportunity, as Dave highlighted there. And again, that word messaging, comes back to this thing that you're so passionate about. I know from the marketing side that we have to get this on point. So for those listening in, I'm sure they're gonna want to know more about this.
Yeah, and as we work with the physicians, part of it is including them in the process so that they actually do some of the guide activities so they can get paid as well. Because when we align all those incentives where everybody is doing better, that's when we can, really do a good job with prevention.
Awesome. And where can they go to learn more about Embrace?
So again, our full name is Embrace Prevention Care, and you can go to embracepreventioncare.com. And if you want to reach me directly, it's dave.dlesk@embracepreventioncare.com.
Super.
Awesome. Well, Dave, we just can't thank you enough for leading on this mission, for coming on and discussing today. And of course, we wish you and the team well for 2025 and beyond.
Well, thanks so much for the opportunity to be able to tell this story. It's very exciting. Virtually everybody I talk to knows someone close to them that is involved in dementia in some way, either as a caregiver or who has it. And so it's something that is sorely needed, and we're anxious to lead the charge there.
Well, ladies and gentlemen, another huge thank you to Dave Dlesk, CEO and co-founder of Embrace Prevention Care. And thank you for tuning into another episode of the Medtech Impact Podcast. I'm Kyle Cruz.
And I'm Richard Meiklejohn. Until next time, keep innovating.